So we know that if you're on a high carbohydrate diet, and I guess what kind of things are we talking about with carbohydrates, Peter?
Well, there's two types, isn't there? There's the sugars, and that we see in, soft drinks and so on, and then there's the starches, which are broken down into glucose and absorbed, and therefore the only difference between the two is that one takes is a bit slower to be digested and to respond, but it's still all basically
sugar in the blood.
Yeah.
And we often assume, we use the term complex carbohydrates to refer to the starches under some misguided notion that they're somehow magically healthy and they don't turn into sugar. So you'll remember the study that Ludwig did, where he said, okay, well, if insulin and carbohydrates and so on and so forth is so important, he put people on low carb diets and compared them to subjects on high carb diets. And he found that the differences between the two at either end of the spectrum was 300 kilocalories a day of energy expenditure. So the subjects on the lowest carbohydrate diets were burning an amount of energy that was equivalent to riding a bike for an hour a day. And this is without any exercise. What it meant is that the subjects on the low carb diet basically were burning 300 kilocalories a day extra for free without any extra effort.
What's the explanation for that, Paul?
Well, because when you eat less carbohydrates, the body releases less insulin. And remember that insulin promotes fat storage. It pushes energy into your fat cells and it doesn't let the energy escape your fat cells. It basically keeps it there. So again, think about this in the context of the calories in, calories out hypothesis. So by going on a low carbohydrate diet, you're able to lose that much extra energy. And here's the kicker. These subjects did this without any compensatory increase in their appetite, which, by the way, almost always happens. Ever heard the term working up an appetite? So this whole thing is like, calories in, calories out. If we just look at it simply from the perspective, well, you just need to exercise more. Well, half of the people who are going to exercise more are going to find that they're going to be hungrier, and they're going to have even more difficulty in regulating their appetite. Whereas simply by eating low carbohydrate diets, the subjects in this study were able to increase their energy expenditure without any need to increase their energy intake.
So you mentioned exercise. Let's have a little chat about exercise because, exercise is obviously important for health. I think we all agree with that. We encourage exercise. But what about exercise for weight loss?
So it's generally ineffective. If we study it, we do find that if you go make a concerted effort and you do regular exercise, especially a combination of exercise where you build your muscle, then you can lose a few kilograms. But the trouble is it doesn't address the root cause of the problem. Well, not to a large degree. It does, to a degree, help insulin work better through a different pathway. We won't bore you with the details, but it does actually help remove a bit of sugar from the blood. And basically what happens every time you contract a muscle, that actually stimulates the muscle to take sugar out of the bloodstream, and it needs to be resistance contractions that do that. High resistance is much better at doing that than, a gentle walk or so on and so forth. So exercise is good to a degree. It makes you healthier. It makes your bones stronger. It helps with depression, strengthens your heart. I mean, there's a long list of the benefits of exercise, but significant weight loss, unfortunately, is not one of them.
Yeah, and it makes you hungrier, as you said. That's the problem.
Now, the other problem, so we've got the problem where, okay, if you eat certain foods, your body's going to release more insulin. We know that. But there's a natural state. Well, it's not a natural state. It's a pathological state. It's a state associated with disease. It's associated with most modern chronic diseases. And that's called insulin resistance. So the job of insulin, the job of any chemical in the body, really, you have a chemical and then it has to have what's called a receptor site. It has to have something that it can go to work on. That's where it does its job. Now, the receptors for insulin, we call them the insulin receptors, in this condition of insulin resistance, they don't work as well as they should. And that forces the body to release even more insulin than it used to. Now, the problem is that insulin is not working very well at the liver. it's not working very well at the muscles. So when it's not working well at these tissues, the body releases more insulin. But do you know where insulin still keeps working? In the fat tissue. In the fat tissue. So insulin's not working in these other tissues. You end up with excess insulin, and it's focusing its efforts on the fat tissues. So we're stuffing it full of fat, and we're not letting that fat escape. Now, there's two key dietary factors that contribute to this insulin resistance. So you alluded to one of them before when we talked about carbohydrates. You said we've got the complex starchy carbohydrates, and we've got the sugary carbohydrates, the table sugar, the sucrose, the high fructose corn syrup. By the way, the cane sugar that we have in Australia is near identical in terms of fructose and glucose to high fructose corn syrup. There's really no difference. They're both quite toxic. Now, if you consume an excess amount of sugars, it's very prone to causing what we call de novo lipogenesis. In English, in plain English, this means your body will turn sugar into fat. And some of those fat compounds, they're what we call lipotoxic. So lipo meaning fat, toxic speaks for itself. And they actually damage the insulin receptors. So when you're having a lot of sugar, that actually damages the insulin receptors, and it means that your body needs to release even more insulin to do the job because it's not working properly. And we know the consequences of having too much insulin is going to be weight gain. Now, there's one other thing that is a significant, I believe, a significant contributor to insulin resistance, and it's not often talked about, and that's seed oils. Now, seed oils actually have a type of fat in them. It's very similar to the toxic fat produced by sugar consumption through the de novo lipogenesis. And the toxic fats in seed oils can also damage how the insulin receptors work. So if we have processed foods, which is rich in sugar and rich in seed oils, and I promise you most all processed foods contain seed oils, then that is just a 1-2 punch on our insulin receptors. They don't work properly. We're going to end up having elevated levels of insulin, and the consequence of that is going to ultimately be obesity. You might be thinking, well, can insulin resistance really matter that much? And yes, it can. So they did a study where they took some young adolescents and they followed them up over a period of 8 years. And they assessed them at the start of the 8-year period to see how insulin resistant they were. Do they have high or low insulin levels? And then they looked at them at the end of the 8-year period and they said, did you have high or low insulin levels? And when they compared the subjects who had the lowest insulin levels, not super low, just in the bottom 25%, which is not particularly low, the subjects with the lowest insulin levels had a 2% chance of becoming obese over that 8-year period. Can you guess what the number was for the subjects in the top quarter for insulin levels, the highest insulin levels?
Well, significantly more than 2%, that's for sure.
72%. Honestly, I mean, this is absolutely a staggering figure, a 36 times increase risk of becoming obesity because of the association of high versus low insulin. If you doubt the power of hormones, especially insulin, to gain weight, then you really ought not. The data is there, the science is there. We've got dozens and dozens of paper that repeatedly show these same findings. Now, you might be thinking, yeah, but how can a chemical just change your behavior like that? So, and we're sort of thinking, well, because eating, it's a volitional action. To eat, you actually have to get your hand and you have to bring something to your mouth, completely in your control. You think, well, that's not controlled by chemicals, that's controlled by me. Well, let's look at a more extreme example. Breathing. So can you take a breath and hold it? Of course you can. You've got control of your breathing. Now, if I ask you to hold it for 5 minutes, you'd say, don't be stupid.
No.
If I said hold it for a minute, you probably wouldn't. What would happen if I said, I'll give you $1 million if you can hold it for a minute?
No problems at all.
You might be able to. So sure. And what is it that's driving our desire to breathe? Well, that's a chemical desire. It's driven by carbon dioxide largely, a little bit by oxygen, a little bit by hydrogen, but really it's carbon dioxide. And while we can override our natural inclination to sort of, want to listen to these chemicals, eventually, at some point, it's going to be irresistible. We're not going to be able to resist. Now, eating is a much less extreme example, but eating and hunger, these behaviors are largely driven by chemicals. So, I've got patients who, have been able to control their weight on low fat diets in the past. They come and see me and they've said, yeah, I used to, for 20 years, I had the low fat diet. I followed the food pyramid and I could maintain my weight. And I'll ask them about, well, how did you do that? And invariably they were white knuckling it. They were struggling every step of the way. And almost without exception, if I asked them enough questions, they were displaying features of restrictive eating disorders. And it's really not a good advertisement for, the food pyramid or the calories in, calories out mantra, when the only way that you can maintain a healthy body weight over a couple of decades is with an eating disorder. So, yes, you can fight it. You can fight these urges, these chemical urges to eat, but only for so long. And invariably, most every single one of these patients who had been able to do it for 5-10 years, however long it was, they would eventually fail. So the reason is we have to understand the chemicals in our brain, the neurotransmitters and hormones, they're sort of the same, that drive these behaviors. So our modern food environment is designed to be addictive. So you talk about a beautiful concept. You talk about real food. And, I've heard you use many different examples. You say, well, if your grandma wouldn't recognize it as food, if it's got, numbers on the label, if it's, you have used a term of a chemical storm and so on and so forth. And this is absolutely true. But the point is, the modern foods, modern processed foods, they are engineered. They are crafted to be addictive. They focus on what they call the bliss point. They get the right amount of sugar, mix it with a bit of fat, enough salt. They focus on the mouthfeel, how it feels in our mouth. And this engineering is done to make it as palatable and as addictive as possible. So it relates to two key chemicals, dopamine and serotonin. And these chemicals drive human behavior. They drive our eating behavior and they drive our desire for procreation. And these are the two behaviors which the survival of the human species is dependent on. In effect, we are hardwired to chase these chemicals. Now, there's several health conditions that can actually lower this level of chemicals in our brains. And when these chemicals are lowered, our desire for them is even stronger. So how do we get these chemicals? In the modern environment, how do we access these chemicals? Well, it's addictive foods. Remember that it drives eating behaviors. The most ready way that you and I can access dopamine and serotonin in our modern environment is to eat junk food. And that will give you a transient respite from feeling lousy. Now, obviously, it's just going to, lead to an ongoing cycle, and it's going to compound the problem in the long term, but you will get a brief respite for how you feel. And that is the scientific explanation for comfort eating, for emotional eating. You're quite literally getting a warm hug from the food. It's making you feel transiently better. And the modern food environment where we've got these junk foods available that hijack our natural state, our natural hardwired state to chase these chemicals, we get hijacked by this addictive food. The simple fact is that for somebody who's overweight, there is no safe amount of this food. Your brain isn't designed to handle this. And further, when we eat this food, it causes disease in us that leads to lower levels of these chemicals to begin with, which makes our drive for them even higher. So the synthesis of these chemicals is dependent on several of the B vitamins, iron, magnesium, zinc, omega-3 fats, all of these things which tend to be deficient in these processed foods. So, you know, this is the problem. We just end up perpetuating the problem. We consume these terribly addictive foods. We end up with lower levels of these neurotransmitter and hormones in the brain, and our desire to have them. We just end in this awful, awful loop.